Hello, lovely people, and welcome to today's A to Z. And we are looking at the letter A and a horrible condition that affects almost 10% of the women population of childbearing age, and that is endometriosis. Now, if you have ever experienced endometriosis, or you've been diagnosed with endometriosis, or you may have a friend with it, you will know how debilitating that can be each month. It is horrible. It's a horrible, horrible disease. And the thing is, what happens is, if you are, as a woman, experiencing really painful menstrual cramps each month, and there'll be other symptoms as well, which I will talk about shortly, you might have to keep going back to your GP, your doctor, and they will do a few tests and they'll say, oh no, there's nothing wrong. And the trouble is with endometriosis, it can take almost up to 7 years to be diagnosed. And then the treatments will either be hormonal contraception or a coil or surgery. And it depends on how bad your symptoms are or what route you want to go down. Some people want to avoid surgery. Some people want surgery because if they are having difficulty conceiving. And another reason it takes a really long time to diagnose is because each woman's symptoms vary. And I see this in my practice. Ladies come to me, and some people might have really bad IBS symptoms when they have their menstrual cycle, and other women might just have very, very painful periods. They might also bleed when they have intercourse. They might have pain when they're urinating. Every woman is very different, and that is another reason that it can take a long time to actually be diagnosed. Now, endometriosis, it's a chronic condition where tissue similar to the womb lining grow in other places, such as the fallopian tubes and the ovaries. Now, if you are trying to get pregnant, that can be a problem because then the sperm can't get to where it needs to go. And that is when you might have to have intervention. Now, the only way that you can be diagnosed with having endometriosis is by having a laparoscopy, which is a tube that actually can go in with a camera and look at your ovaries, your fallopian tubes, and see what is going on. Now, I have helped hundreds of women with endometriosis. They have come to me because they have been passed from pillar to post. They still don't have any answers, or they may have had surgery, but the lesions have grown back again. And they are despairing because they don't necessarily want to have those organs removed. So they come to me and I will work with remedies. I'm often asked what remedies can help with endometriosis. And this is where homeopathy is very different to conventional medicine. It is tailored to each individual. But one remedy I do suggest, which may or may not help you, but it's kind of like the homeopathic aspirin, which is called Mag-Fos. And that might help with some pains. But some of the remedies I will use when I prescribe to somebody with endometriosis, the first thing is to get their period pain manageable. I've worked with ladies where they have been literally bedbound for 3 days whilst they have their period, and they have IBS symptoms at the same time, and they really can't leave home, and they are dependent on somebody helping them. And then I've worked with other ladies that have pain for about a day, but they can manage it with inflammatory medication. So depending on how your symptoms are, depends on the treatment that I usually provide. But I will always, the first thing is to try and get you to a place where you can start doing more each month. Then slowly we look at gradually we reduce your pain, and then we look at hopefully getting your symptoms much better and improved. And I have helped ladies that have problems conceiving actually conceive with homeopathic remedies. My approach is very individualized, and we look at what's going on, and the remedies are changed quite a lot But the remedies that I may use would be sepia, pulsatilla, thuja, medorrhinum, sabine. There are lots and lots of different remedies depending on your case. Now, if you have endometriosis and you've been passed from pillar to post, or you're waiting for a diagnosis, or you're waiting for something, if you want to have a chat with me, I offer free 20-minute calls, and we can discuss your symptoms, and then you can decide if you want to work with me. But surgery is not the only route, or you might just be waiting for a diagnosis. I can actually help, and homeopathy is amazing with helping ladies with their symptoms. You can also go onto my website, Tracy Campbell Homeopath, and do a search for endometriosis and just have a look and see how I can help you. So I will be back with F next time, and thank you so much for listening.